Urinary incontinence is a terrible incapacity for a man. Constantly leaking urine, wearing pads, wetting your pants, it's a terrible thing to live with. And happily these days it can now be fixed. Urinary incontinence for men in particular occurs after cancer surgery, especially after radical prostatectomy for prostate cancer. Now it is true that with better surgical techniques it's nowhere near as common as it used to be, but it still happens. And for those men who are wet, it's important that they be properly rehabilitated. If a man has mild incontinence, vigorous pelvic floor training may well fix the problem. If it's mild to moderate, the new male sling is very good at stopping him leaking and relieving him of the need to wear urinary incontinence pads. The gold standard for incontinence is the artificial urinary sphincter. This is a device that's been implanted in men for nearly 20 years. It has a proven track record and highly successful. It comprises a small inflatable cuff that is positioned around the urethra, a small reservoir that is behind the pubic bone, and a small activation pump that's within the scrotum. The cuff is filled with saline solution and that compresses the urethra and restores continence. When the bladder's full and the man wants to empty his bladder, he simply feels for the pump in the scrotum and presses it twice. This releases the cuff, the bladder empties, and the reservoir, due to elastic recoil, automatically refills the cuff. Urinary incontinence is a terrible thing to live with. It can be fixed. A man mustn't put up with it. He should see a general practitioner, be referred to a urologist, expert in this field of surgery, and have the matter dealt with, either with a sling or with the artificial urinary sphincter.